Good day, everyone. My name is David Williams, Executive Director of the International Association for Energy Economics. It gives me great pleasure to welcome you to today's webinar entitled Electricity Demand, Mobility, COVID-19 Contagion Nexus, and with Heavy Lockdown. We are very grateful for our presenters, Dr. Andrea Bollino and Chiara for today's timely discussion. First, a little bit about the International Association for Energy Economics. We are the largest association specializing in the field of energy economics and provide a forum for the exchange of ideas, experience, and issues among professionals interested in the field. The organization produces 2 professional journals, a newsletter, and holds conferences and virtual presentations, along with a host of other products and services you can find on our website at www.iaee.org. If you're not already a member of the association, we welcome you to join. A few housekeeping matters in regard to today's webinar before I hand things over to our speakers. First, this webinar is being recorded for those that cannot participate in today's live event. If you have any questions for our panelists, please click the Q&A button at the bottom of your Zoom window and type your question. We have allocated sufficient time at the end of this webinar to address your questions. And now I would like to introduce you to our moderator and presenter and IAEE past president, Dr. Andrea Bollino, Professor of Economics and Energy Economics at the University of Perugia. Andrea, over to you.
Thank you very much, Dave. Welcome to all our members and friends of the International Association for Energy Economics. Today with me is my colleague, Professor Chiara from the University of Perugia. I will immediately share the screen with you to motivate the analysis that we have done. This is, I will do it in a moment, this is essentially an econometric, sheer econometric analysis of the data that has been made available day after day for this very tragic or severe event that has hit the entire world. So in Italy, as well as everywhere in the world, we have concentrated our analysis on the Italian data, and we will possibly continue to analyze the rest the more the data becomes available. What we have done was to collect hourly data, the electricity market, which then we averaged on daily data. So daily data on the electricity demand starting February 23rd, we started even before, but the date that we will present you for our econometric estimation and our analysis that we would like to share with you to have your ideas, your inputs, your comments, your critiques, is essentially from starting February 23rd, we collected data on the electricity demand day after day. Then we went to the Italian Ministry of Health, which has been publishing every day the daily report on some variables, key variables pertaining to the COVID contagion, like the number of swabs, the number of hospitalized people, the number of positive cases, the number of people in intensive care, and the number of deaths. They have been broadcasting on the Italian television. I'm sure they've done it all over your countries as well. Every day, then, what is happening in this region, in that region, more deaths, more positive and at the beginning. And then, fortunately, less deaths, less intensive care in the last period. And then we collected, thanks to Google, that everyone, so this is public data that everyone can download from his own computer. We have downloaded the Google data on mobility. Google has analyzed data with their own software, and it is published, so I don't dwell on that much more. Essentially allowing you to understand how much intense has been the lockdown at home, in the workplace, and they've also collected the mobility analysis in the parks, recreation areas, or whatever, okay, and station and train stations and whatever. But we concentrated only the first two, residential and work. So now the analysis. Sorry, this is much less, I will apologize in advance, much less, how can I say, intense than other very interesting webinars that I've assisted in this last period, organized by Dave Williams, whom I thank again for this invitation. This will be an econometric attempt to share with you the following information. So first of all, let me immediately show you that our title, Electricity Demand, Mobility, COVID-19 Contagion Nexus with COVID lockdown, has been motivated by this. Day one is, as I say, February 23rd. As you can see, there has been a moment in which more or less we try to adjust these numbers for the temperature differences between the same calendar, excuse me, not calendar, but weekday. So we started with a Monday and we took the Monday of 2019 in order not to have a spurious, of course, correlation between different days in the week. We have also adjusted, by the way, the data as much as we could for the Eastern weekend and May 1st, which is the very last 2 days are May 1st and May 2nd. And May 1st is a holiday in Italy, as usual. So we take the daily percentage change of the year 2020 over 2019. As you can see, it was more or less zero, and then it started to precipitate -10, -20, -30, -40, -50% was day 49, 50, -50% electricity demand on the Italian network. So essentially half of usual, half with respect to business as usual. Then we looked at Google data mobility. As you can see, pretty much at the period at the beginning in which the news, remember Italy was one of the first countries that were affected, and we were essentially probably not completely well prepared. We hope that our experience, tragic experience, has been useful for other countries who started later to have the contagion. I will see you the contagion later. So at a certain moment, the mobility in the workplace, when the government decided to lock down firms' activities and lock down people at home, went down -40, -60, as you can see, all the way down to around the day 50. Remember, it's the same as electricity, -80%. So this was the moment in which Italy was standstill. The mobility at home, so how more than average people remained at home, as you can see, went up to 20, 30, 40%. So these two images are specular of the movement of people who were not going to work, except from smart working, of course. And by the way, doing smart working, they were consuming more electricity at home with their computers and staying more at home, okay? This is the number of hospital cases. As you can see, the hospitalized people with symptoms were increasingly dramatically up to a certain point. And then around day 40, between 40 and 50, let's put it this way, the plateau started to decline. Same thing with the people in intensive care, okay? This is the number of new positive, so the change every day. So we got a peak of new positive here around 67,000. And this is the total swabs, okay? So the more, and the idea is this one, the more you swab people, I hope English is correct to use it as a verb, the more you put swabs on people, the more you find, of course, contagion. But the important thing is, we think, is to analyze what is happening to the unknown proportion, because no one starting the WHO or anybody else, not even, I should say, in America, the respectful Dr. Fauci, has been able to tell us what is the percentage of severe cases in percentage of the population. We have the percentage over the swabs, but the swabs have been done casually. We have the percentage over the hospital cases, but people will reach the hospital. Sometimes they do, sometimes they don't. So that's the idea. The only, we think, concrete number is that, as you can see, we got 5,000 citizens in the intensive care in the hospital in one moment in time in Italy. Now, We have then aggregated these data according to the regional electric zones of Italy. So this is a seminar on energy, so we wanted to look at the energy behavior. As you can see, the northern part of Italy, which is the one, north and center north, which is the part of Italy with the heavy industrial activities, manufacturing, heavy steel, smelting, glass or whatever, as you can see, got a much more severe energy variation with respect to the others. Of course, because Northern Italy weighs more than half or 50% of the Italian manufacturing activity, the weighted average of Italy, as you can see, is the picture I showed you before, is closer to Northern Italy than to the other smaller electric region. South, Sicily, Sardinia. South is 4 million something, Sicily is almost 4 million, and Sardinia is 2 million, even less than 2 million. Okay, so these are smaller proportion of people. However, as you can see, because of the government, I may say, and I will return this to the end, one-size-fits-all measures. There's been a lot of debate in Italy between the local governments, what in America you would call the governors of the state, and the federal government. We had the same debate on what to do and what not to do. Anyway, as you can see, given the prevailing prescription of the central government, the work mobility place has been moreover equal all over. At home, much more pronounced in the northern region than in the southern regions. You know, the southern regions, they like to, stay, more in social activity. So somehow the residential lockdown apparently has been lower, okay? So this is the intensive care as a percentage of the population. As you can see, so we divided the numbers we saw before by regions, north, center north, and then the rest of Italy. So essentially Italy was, as you have learned, it was divided in two. So we asked the following question: is there a statistical, a causal, an econometric nexus between these three variables? The energy, electricity demand, the mobility of people, and the contagion variables, the type of variables that you can use for contagion. So we started, first of all, to consider that energy used in the workplace is a function of economic activity. Energy used in residential households is a function of household activity. So obviously, by summing the two, you can get that energy is a function of both variables. If we make the difference with respect to normal, so change of E is like change of F. So mathematically, we consider that the change of E should have been, that's the research hypothesis, a function of lockdown, as well as we hope to find some impact of the lockdown measures on the COVID contagion. You all remember that the major suggestion given at the beginning by the WHO and all the scientists, the medical scientists on this issue is peak shaving, what we electricity people know as peak shaving. Make sure that you can slow down with lockdown measures the contagion in such a way that the hospital facilities can treat all the severe cases, intensive care, so that you do not let people die unattended, okay? So, first of all, we started with a set of Granger causality tests. I will be very quick in telling you that we find always, I will tell you, a relationship between energy and what we consider a proxy of the economic activity. So we are satisfied in some sense to find, I will show you some statistical coefficients later of our estimation. We find that the change of energy is a function of the change of economic activity. So an input demand function for energy is even in some sense demonstrated by our daily data So in such a very strange data set, usually we have thousands of papers in our scientific journals of the energy demand as a function of GDP, of economic activity, of course, on a much lower frequency data, annual data, panel data, monthly data, but certainly not daily data. So let me tell you, the bottom line you will always see a simultaneous feedback. Then we notice that, and that's the most important thing, that intensive care numbers or variable has some granular causality into the energy demand, but not so for the hospitalized people and not so for the positive cases. We think that this can be capturing, if at all, these are all maintains hypotheses, this can be capturing some technological factor. The fact that you need more intensive care, you need more people in the ambulance, in the hospitals, in building new intensive care hospitals, could have had an influence on the energy demand in granular sense. However, we do not find an impact of residential mobility on the number of intensive care. We do not find granular causality from the workplace mobility to intensive care. However, we find some effect on the number of hospitalized people by the work mobility lockdown and residential lockdown, and the same we find as an influence from the workplace mobility to the number of positive cases and residential mobility again. So what are the results? First of all, we are glad to confirm the existence of an input-demand function according to economic theory. Then we ask, is the change of energy a function of COVID, as I say, only possibly for this technical effect, or it is a spurious effect of our data, of course. But then we come to the next question. The COVID, has it been influenced by the lockdown? As I said, the positive cases, yes. The hospitalized cases, yes. But let me tell you, these are the only news that were broadcasted on the Italian evening news every day. The number of positive cases today have been, the number of people in the hospital have been. They never talked about intensive care. But we think that intensive care is the, unfortunately, how can I say in English, is the true, excuse me for the word, is the true effect of the contagion. Because we know that there are a lot of asymptomatic people, and we do not know how many are the asymptomatic people. I could be myself. I'm perfectly in good health, but I didn't swab. I didn't put a swab because swabs have been organized only for those with symptoms, and a proportion of those, unluckily, were put in intensive care. So we find no granular causality whatsoever from the lockdown at work that has influenced intensive care people. The lockdown at home has not influenced intensive care people, okay? We did also a VAR, a vector autoregressive analysis with these three variables. We call it, let's say, electricity, mobility, and intensive care. This is the forecast error variable decomposition, which, I will skip for the moment. And then here are essentially the interesting results of our vector autoregressive estimation by regions. So this is a panel of VAR. These are the regions of Italy: center north, center south, north, Sardinia, Sicily, and south. To give you an idea, north is Milan and Venice, center north is Florence, center south is Naples, and Sardinia, Sicily are the islands, just to give you how the electric zone comply with your knowledge, of the Italian beautiful vacation sites that you have visited in your life. Okay, so this is what we can show you. As you can see, we have essentially a confirmation of what I call the short-term production function. As you can see, energy is a function of the economic activity, reacts to the economic activity, and as you can see, in all regions, these are, as you can see, very statistically significant, okay? Then, as you can see, there is indeed in the whole Italy an overall, as I said, non-impact of mobility on the intensive care. However, we find significant coefficients, especially in northern Italy. In all the other regions, as you can see, this is not, okay? So in our vector autoregressive, essentially, we find, of course, confirmation of our Granger test in econometric terms. So now, you know, we repeat the same vector autoregressive 3 variables using the number of hospitalized people rather than the number in intensive care. And you may notice that indeed, as the Granger causality is telling us, there has been some impact of mobility, which means mobility lockdown, on the number of hospitalized people. The more you lock down, excuse me, the impact is positive. So in some sense, the more the lockdown, the less people are hospitalized. No? So there is a positive effect, apparently, according with this data. Now, a caveat is in order. We are using data published as any researcher can find. So the reason why, for instance, we have not presented to you any information, any data about the number of deaths, which is actually the most tragic conclusion of the contagion. Swabs, positive people, hospitalized, intensive care, unfortunately deaths. Well, we have noticed, and all of you have noticed, that in Germany, the number of deaths is 1/4 of the number of deaths in Italy, with a comparable number of apparently contagion. So excluding that there is a superior German race that they have, how can I say, a better health in their own body, this means that the way the doctors, the hospitals are recording in their statistics the number of deaths is different. In Italy, we know we record a death for any other accident which has been also hit by COVID as a COVID death. In other countries, you are considered statistically a death caused by COVID only if you started in good health and the only cause of your unfortunate disease, death, is COVID. So obviously, this way of recording statistics, if they are not harmonized, cannot give you the idea of what is really, the phenomenon. That is why, I repeat it, we used the number of intensive care, because the number of intensive care are the true indicator of the gravity, of the importance of the contagion. If you have a lot of intensive care people, it's because whatever is the chain from contagion, asymptomatic, light symptoms, the most important thing is when you reach a critical stage of your health. And that's why we have used this, okay? With this, then, I can come to the conclusions and leave space for questions and discussion, critiques. I hope I can have, some heavy critiques so that we can reinforce our analysis. By repeating the analysis for regions, also for subperiods, the first half of the sample, the first, you say 30 days, and the second 30 days, we got pretty much the same result. Then we say that the number of intensive care cases has not been influenced by the lockdown measure overall on the national data. And when we go down to the regional analysis, it's true for all the regions except the northern. We have noticed that the number of positive cases has been somehow influenced by the lockdown measures, both at home and at work, in all regions and in Italy. What is the implications? Okay, these are the questions that I have for you. Are the lockdown measures being too excessive? I mean, if there has been no impact of the lockdown measure, which in Italy were implemented by successive waves, severe, more stringent, not only the red zones, which were red zones since the beginning, But you know, first of all, they started to close you know, the regional areas and then the local municipality. Then they said you can walk within 1 kilometer around your house. After another week, the government came and said you can walk only around 200 meters around your house. You can walk only if you have a dog or a pet to bring out, and the children should stay locked home. So they continued to, you know, make more and more stringent. Based on what? Eventually, what we think, on the fear induced by the positive cases broadcasted by the television, because the number of intensive care has not been overall influenced, except in northern Italy, by the measures. Then there is this idea, which is really the last idea we want to leave you with. We found different regional effects. So is the one-size-fits-all approach of the central government wrong or right? You see, I mean, now that the number, I mean, let me be very clear, because the emotional issues because of the contagion and the number of deaths of older people, of elderly people, has hit all of us all over the world. However, there is somehow a trade-off now between human lives and economic lives. We are risking, with the too excessive measure, to put enterprises to death, okay? Because they have, as they now are saying in all newspapers and social all over the world, we have 100% reduction of revenue, and we continue to pay 100% of fixed cost. With this, we cannot survive. And the banking loans are not enough. We cannot make, so I go over with some economic analysis before concluding this analysis. Well, we cannot use only loans, deficit, banking loans to face such an unprecedented symmetric shock on the entire economy. You need some macroeconomic measures. Here, we wanted to see the central government. And to be honest, maybe I have a wrong view, but so far, the United States of America has faced the economic, I'm not questioning the rest, but has faced the macroeconomic problem much better than Europe, because your parliament, after a lot of debate between Democrats and Republicans, this and that, your parliament has voted a comprehensive package of 2.2, 2.5, whatever billion dollars that are effectively helping, it's like money helping people to survive the crisis. In Europe, we are still talking about whether we have to implement a recovery fund, whether we have to use the European state mechanism system, make new bonds by the European Bank of Reconstruction, or whatever. So measures that are announced on paper, but have not injected liquidity in the economic system as it is necessary. The only, because the market works, if I can go back to the first slide I presented to you, the only hope is this one. And that is, you can see that after minus 50% of electricity demand, in the last, this is the last week after the 23rd of April, the last day is the 2nd of May. As you can see, some economic activity has been put back to work, like in many other countries. And so hopefully some money is starting to roll over again. And to be, how can I say, arrogant, I will tell you that the next webinar I will present you is to see if I can find a way to predict with electricity demand how much reduction of GDP and of economic activity in money terms, in euro terms in Europe, in dollar terms in America, has been caused by this unprecedented administrative lockdown of the free market. Because what we have done was to have a government superior entity, for a good cause for sure, who has said the free market activity has been stopped, and these are the consequences. So I stop here. I thank you. I'm here, as I said, at the end. Show you. Okay, and this is it. And I can stop sharing the image, or I can go back to that if you are interested in. Sorry that it's the first time I'm in this webinar, so I don't see if there is any question in the chat or in the panelist.
Marcio Galeotti raised the hand.
Please, of course. I don't know. I'm not the. I think the master. I think the energy economics. Dave Williams should give the.
Okay.
No, it was a mistake. Stop.
Okay, I'm here with you both. I'm David Williams, but I'm not seeing any questions come in yet.
Okay.
Maybe Maria, would be good to hear from you on
Yes.
some of your reflections on the presentation and some of the good research you've put into this. I personally have found this very fascinating, particularly with the statistics and some of the results that you have presented on just on perception matters and you know, the overall effect that COVID-19 has had on, you know, the hospital usage on beds and whatnot. So I put it back to you for some comments, and I think maybe another question has come in while I've talked. So please proceed.
I didn't understand the question.
Well, we do have a question here.
Oh, yes.
When the lockdown was introduced, the number of cases was already very high in the north, but nearly zero in the south. That means that the lockdown resulted in the change in the accesses to the ICUs in the north as expected, but resulted in little changes in the south, where there were little or no people in the ICUs. Is it possible that the differences in the starting conditions explain your results, and to what extent?
Well, this is a fascinating question by our friend Carlo, who is, by the way, an energy economist in Italy, who has been very attentive on these things. Well, in some sense, we have to distinguish between Granger causality and then the correlation. I mean, we exactly wanted to say is that essentially the idea of making measures which were equal or governed anyway, which are governed by the states, the different regions, is something that is probably has not been good for all. Why? Because you correctly pointed out, in northern Italy, the idea is that they were unprepared. We do not know, because remember, the regional governments wanted to do their own measures, and at the beginning there was some delay from the central government to allow. We have seen this all over. Let's go out of Italy. You remember Prime Minister Boris Johnson, who said, let's have, you know, herd immunity by letting everybody have a free contagion, so we will get up quickly. So there has been a delay in taking the confinement measures, a difference in getting the confinement measures. And then coming to, again, to the question, the idea is this one. In the South, they had some intensive care, okay, but we do not see, how can I say, we do not see causal effect of the South lockdown on the South intensive care. Maybe it's a statistical artifact, we do not know. But what I wanted to explain is that essentially we can say the reverse. The high number of intensive care at the beginning in northern Italy was given because, this would be my explanation that I would tend to pursue later, of course, is simply because northern Italy has a much more dense population. a region like Umbria, where I teach, University of Perugia, has 0 contagion in several municipalities. There are 90 municipalities. So in Umbria, there was 1 red case with 300 people, and then many other areas with 0, not with 1, with 0, 0, 0 in the first day and 0 now, meaning that they were completely isolated from the contagion. So we do not know if it was the social and urban condition that has been, in some sense, more effective, I should use this word, to spread the contagion, than in other areas. It's the same thing that happened in the United States. New York has been much harder hit because it was a dense urban area of 12 million people.
Just one thing again, the test was the results take into account the panel structure of the data. So we can differentiate between the in-granger causality between northern zone or the center north, the center south, and for this reason, I think we can say if some zone. If in some zone there is a granger causality between intensive care and the energy or mobility, we reject the null hypothesis. That's why, for this reason, we take into account the panel structure when in the results of the Granger test, and this can be just one modality, just another way to differentiate between the different regions and the different spread of the contagion. Just this.
Yes, I certainly agree. Okay, so
okay, there is another question. Do the figures for intensive care include just the COVID patients or everyone? Also, people with other health issues?
Just COVID.
Yes, it's specific people in intensive care. And as you remember, we had, in fact, after seeing, you remember the Chinese that built one hospital, an entire hospital in 1 week, you know, we saw this on television in early February. We started to do the same thing in Italy. In northern Italy, we built,
the patients were isolated.
Yes, essentially. And then in the rest of the regions, the measures that have been taken were to dedicate some local hospitals only to COVID, to concentrate so from the territory. Just to make an example, in Umbria, we have 3 major hospitals in northern Umbria, in central part of northern Umbria. One was dedicated only to COVID. So the typical patient of that local area was directed for any other health problem, heart disease, diabetes, or whatever, in the so-called non-COVID hospitals. So that's also to make the, you know, the distance, the social distance more effective. At least these were regional, by the way, these were regional analysis. But then, you know, let me say again that, of course, we are all concentrated now on the health issues, but we are much also, as an energy economist, we should also, I think, be aware or preoccupied, worried about the health of the economic system. The idea is that if you knock down an economy by, now they say the GDP decline will be 10, 15%. If you knock down an economy, which is so much intertwined with the, you know, global economy, offshoring, you know, the value chain dispersed in several different places of the world. By locking down the economy, you may have an indirect effect, which is much higher than you have thought. That's why I want you to continue to check the electricity demand, because we all know that in real time, the consumption of electricity is an interesting indicator to understand what is happening to the economic activity.
Very good, very good. Thank you, Andrea. There is another one.
Yes.
Are there other data or variables you would like to have studied but did not have access to?
Other data, excuse me, because I cannot see the answers myself.
Variables.
Excuse me?
there are other health variables we would like to study and put in correlation with energy demand.
Well, yes, there will be a statistical analysis conducted by the Italian Statistical Office, which has designed professors of statistics all over the universities in different regions. In the University of Perugia, for instance, there is a group of my colleagues who have been dedicated to this one. They are now trying to make a representative sample. Because you see, if you have a number of swabs, and the swabs are made to, you know, random, but not random representing the population. They're made random for whatever reason. You do not have a statistical representation of the population. All you have to do is to do like when you do, you know, a survey analysis. So the idea is to possibly resurvey the cases, swabs, and then symptoms, and possibly, I imagine, also intensive care, to see if there is any covariate in the statistical analysis that can be, you know, stratified to represent significantly the population, so that we can have an idea of what is the impact of this on the population. So far, in some sense, if with the language of the economist, which is not appropriate, but what I'm trying to say is that we have to go from, you know, cash to competence. See, we are counting the number of people every day, okay? That's a cash concept. We have to have the competence concept. So that is to which category of people can we statistically attribute that behavior? And this can be done only with a statistical analysis. And that has been, by the way, performed by the government only lately, not at the beginning. Yes?
Thank you, Andrea. In the meantime, Rebecca is reaching out to Amelia to see if perhaps she can come live.
Yes, she wants to speak. Yes, of course.
Because
of course.
She's got several of them. And so technologically, we're working on this to see if we can't just bring her into the webinar to engage in some of these good discussions. In the meantime, nothing else has come in. Have you any more builds you would like to make, or indications that you can share with us on the future research you plan to do? There's no doubt here that you've striked on a good topic for continual research and for feeding this information back, certainly to those within IAEE and others that are interested in the actual facts of what has been occurring.
Yes, and I see also, yes, this is the idea. The future line of research, as I say, would be to make a stronger, if I can make a stronger case of the high frequency content of information of energy, energy load in the network. For instance, just to give you some ideas, we started and then we didn't have time because Dave, you gave us such a short notice to prepare this webinar. I'm joking, of course. But if you take the electricity data, not by the daily average, but by the hour, you can get a different profile of hour 1, hour 2, hour 3, midday, 3 in the afternoon, 5 o'clock. You see what I mean? 9 in the evening. And that can help to understand better the pattern of change in habit that has been induced by the lockdown and the contagion effect. Why am I saying this one? Well, because, for instance, if you have a heavy industry working for 24 hours, like steel or aluminum or whatever, that is either on or off. I mean, it's a base load, more or less. I mean, in the sense that it consumes electricity for 24 hours. Your refrigerator consumes electricity for 24 hours at home. So there are certain, usage of electricity which can be, I think, understood if they are specific to the hours, in the sense, if you are going out for dinner in a certain percentage of days of your month, then you do not switch on the electricity at home, and vice versa. Stupid example, to say that we can, we could make an even more refined analysis to see if the electricity has been influenced. For instance, during the 9 to 5 period, that should have had a stronger influence, this is a maintained hypothesis, of the of the work lockdown, because you don't go to work, and so you do not consume electricity in the hours in which between 9 to 5, typical hours of work, except the smart working, of course. Then if you look at the hours in the evening when people go socially out for dinner in a pub or whatever, so from 6 in the afternoon, let's say, until 10, that should be more correlated, perhaps, this is a maintained hypothesis to investigate, with the residential lockdown, because people were forced to stay at home, and so they consumed only one, say, kilowatt to watch television rather than many megawatts of stroboscopic light in the discotheque. I'm making it up to make you understand that these things can be investigated very precisely, even by the hour, to correlate it again with this phenomenon. I see, by the way, Dave, that Emilia Somalai asks a permission to make a question in words if you unmute her. Is this possible, you think, or?
So we have been communicating with her electronically, and her latest question indicates that we have addressed all of her questions. So I think I think this is we might be winding down now.
Yes.
So perhaps you could make some closing remarks on your side, and we'll close things down.
Yes. So first of all, yes, I thank everybody for participation. I thank Maria Chiara for working with me, like she thanks me for working with me. No, of course, we work together. I also thank all the questions. As I say, we think that either these data were wrong, and so we made a generous exercise to extract some information from this data that will prove later not so important, or we want really to make the case that when you have such a strong distress in the economic activity due to an exogenous shock, it is worthwhile to investigate immediately in order to have some essentially better measures, better understanding on how to cope or to behave next time, okay? So unlike all those who were making critics of that doctor, that prime minister, that president, or that, or because they were not doing the right thing, quote unquote, I think that as scientists, we have to exploit all the data we have available, and this rich idea, we think, we offer to you, to make the nexus of 3 variables, like those, electricity, a proxy for economic activity at home or at work, and the exogenous shock, is something that is worthwhile, and we want to pursue it all the way to a scientific paper, that's for sure.
Very good, very good. In conclusion, IAEE wishes to thank Professors Andrea Bollino and Maria Chiara D'Arco and for today's outstanding webinar. I know personally myself, I've really been looking forward to this one. We don't have a lot of research in this area, and we certainly need more of it. So please continue to feed us good data on this. This webinar will be available on IAEE's website for future download for those that have not been able to listen. If you're not already a member of IAEE, we encourage you to join by visiting us at www.iaee.org. Thank you for attending. Wish you all a wonderful weekend, and I officially close this webinar. Thank you.
Thank you. Bye.
Thank you very much.